Liz Wilde, who's been looking at the problem. And in fact, all of our Norfolk MPs have signed a pledge backing that the UEA should get a dental school. James, thanks very much for joining us. Good morning to you.
Good morning to you. Hi.
Tell me why you think the UEA, why that should become the next dental training school.
Well, I think as part of the longer-term solutions to the problems that we have with people not being able to see dentists very easily, is about having more training, and the government's committed to 40% increase in the number of undergraduate training places, and they should be in areas like Norfolk where there is a lack of dental provision. If people come and train here, then we hope that they would stay in the area and then boost the number of dentists that we have. So I think we've got a very strong case, as you say. All of the MPs across Norfolk are working with the UEA, supporting their bid. I raised it in the House when the Health Secretary made the announcement this week of the dental recovery plan. I put the case for the UEA, and we'll need to keep making that case as more details come available about the process for selecting the areas that are going to get the new training places.
How do you make sure that Norfolk is top of the list then? Because you're quite right. You look at the boxes that were set out earlier this week by the government about it being in places with a lack of dental provision, and there's already existing medical training at the UEA. So it does seem as if in this part of the world ticks most of those boxes, doesn't it?
Well, I think so, but we're probably a bit biased, aren't we? So we've got to make that case to the Health Secretary, who's a Lincolnshire MP, so she's not too far from us. So she knows, and she said she understood the issues that there are in Norfolk. And I think with the UEA, we've got a track record of what they do in terms of medical training, and developing the dental school, building on their dental development centre is a logical thing to do. But obviously there are other places that are also making arguments. It's a bit like when we were campaigning for QEH to be on the new hospitals list. Obviously other areas had strong bids as well, but we were successful there because we had a compelling bid in the end that was successful. So by working together, I think all of the MPs with the UEA and others, we can help put the case in front of the Health Secretary, and hopefully she'll make the right decision, which is to have a dental training school at the University of East Anglia, which will also complement what's happening in King's Lynn. The College of West Anglia, for example, they're developing apprenticeships in dentistry and dental therapists and hygienists, because it's not just about having dentists per se. There are other people, skilled people within the profession who can do things. So we need to have all the tools in the kit.
How convinced are you that having a training centre here would increase the number of dentists working in Norfolk? And I ask that because we were talking to Andy Bell a bit earlier on, and he was telling us that they've had a similar dental school recently open in Plymouth. That's the most recent example. And actually a lot of the dentists who've trained there haven't stayed. And actually part of the issue is that the last part of your dental training is you go and work on placement, and that could be anywhere in the country. So if that last year of training isn't done in Norfolk, actually these dentists we could end up training dentists for the rest of the country, couldn't we, in Norfolk?
Well, I'm positive about Norfolk. A Norfolk boy, so I think it's a great place. And once people come here and experience it, then I think you develop an affinity and want to stay in the area. Of course, some people won't stay here, but if they don't come and train in Norfolk, then there's far less chance that they would stay here if they haven't been here to train here in the first place. So I think if we have a dental school here, I'm optimistic that all the things that Norfolk has to offer would mean that some people would want to stay. We're seeing with the new hospitals that are coming at QH in Paget that announcement is attracting good people who want to come and work in Norfolk, who want to be based where there's top class facilities. So I think if we had a dental training school, people come here, they experience everything Norfolk has to offer, then I think a good number of them would stay. Of course, not all of them, but far more would than if there wasn't a dental school in the first place.
The point stands, though, that there are other parts of the country that have similar lack of dentists. So even if there was dentists qualified in Norfolk, they would be in demand across the country, wouldn't they?
They would, yeah. We need to get more dentists. We also there's a whole range of things in this package. A new patient bonus for taking on patients who haven't been seen, particularly for 2 years, obviously with COVID. £20,000 incentive payments to get dentists to come and work in underserved areas like Norfolk. Higher payments for treatment. This is all backed up by £200 million of extra funding. And there's things like dental vans, which have worked well in Cornwall, which will come to areas including Norfolk and offer treatment, offer fillings and such like, as well as doing work in school. So there's a whole range of things that are in here. Obviously, the training and getting more people training is part of it. One of the issues I raised with the Health Secretary last month was about making it easier for people to work in the NHS as a dentist. At the moment, it's easier to work as a private dentist than it is to work in the NHS. And one of the things in the plan that I was pleased to see is to make it easier for people to get their NHS performers number and to get on the NHS performance list, because that's been an issue with the new practice that opened in Lynn, the Smile practice. They're having problems getting their approval. So by doing all of these things, we can make it easier, because at the moment it's too hard to get to see a dentist, and that's what we need to fix.
And I just wanted to finish by putting another point to you that Andy Bell raised, actually. Andy's a Norfolk dentist, a member of the General Dental Practice Committee who joined us earlier. He was a little concerned about, if there was to be a new dental school at the UEA, where the trainers, where the teachers would come from. But his concern was, wouldn't we have to take dentists out of practice or practicing at the moment to do the teaching? And therefore, actually, in the short term, the shortage of dentists would become even more of a problem.
Well, I think I heard the Vice-Chancellor on earlier, who's confident they can deliver their plans. They've got well-developed plans here. So I don't think that would be an issue. I think that's something that they would address in what they're putting forward. They know what they're doing. They do it in medical training. So I think that we want to get a dental school into the UEA, because it will help all of Norfolk, and I think that's a positive thing to do. And if I could, just wish Jill Bennett a happy retirement. She's done some brilliant reporting over the years, particularly on the QEH.
I was going to ask you about Jill at the end of this. So, yeah, go on then, James. You've met her many times. She's worked with us here at BBC Radio Norfolk for 44 years. She was here on day one, and this is her last day. It's quite some service, that, isn't it? 44 years?
It is. It's incredible. She's always popping up whenever I'm out and about around northwest Norfolk, with her microphone ready to do an interview. So it'll be quite strange her not being there. She must just be disappointed she's not going to be reporting on the Mart next week, which is obviously a big event in West Norfolk, which she's done for many years now. So I wish her a happy retirement, because she certainly deserved it. And Radio Norfolk, I think, will be a little bit worse off for not having her on the air.
James, good words, James Wild. Thank you very much for joining us this morning. The Northwest